Alright, so if I teach about seizures, so I'm gonna start with some written notes I have already written. After completing them, I will write further notes. So I have written them, so I'm gonna teach them. I'm gonna teach from them only. Okay. Alright, so if I talk about seizures, so it is a sudden temporary neurological event. See what's going on here. It is mainly due to abnormal electricity of the brain. Alright, these are the two lines that you have to mention in the definition of the seizures. And there is actually two phases after the seizure, that there's ictal phase and the post-ictal phase. Ictal phase is the it is like first symptom of seizure to end, but post-ictal is after seizure. uh, there there will be a gradual recovery to baseline. That will be post-ictal and one will be ictal. All right. Of the seizures, if I talk about clinical features, so in clinical features there will be loss of consciousness, there will be abnormal motor activity, there will be abnormal sensation, right? And it will range from mild to severe. Very easy to understand. All right. Mild will lead to loss of awareness. All right. But severe will include tonic and clonic. So in the clinical features, there will be loss of consciousness, there will be weakness, there will be anxiety, there will be staring, there will be contraction and jerking of the muscles, and there will be confused speech. So I'm going to write these points: consciousness plus weakness plus anxiety plus staring plus contraction and jerking of muscles plus confused speech. All right. In the psychic symptoms, there will be, it can lead to focal seizures. There could be dysphagia. There could be a feeling of familiarity, and that is known as deja vu. Okay. There could be distortion of the time, and high cortical areas could also be affected, and there could be fear and hallucinations also. All right. Now if I talk about the autonomic symptoms, it will include epigastric sensations. And epigastric sensation will lead to, it is part of common aura. I will talk about aura in detail. And epigastric sensations mainly seen in medial temporal lobe epilepsy. All right, it is temporal. Okay, right. And autonomic symptoms also include sweating, piloerection, and pupillary changes. They are very, very important to mention. All right. Now, if we talk about seizure auras, in the seizure auras, it is like warnings before any major seizure activity. For auras, you can write that auras equal to focal aware seizures. All right, it affects brain enough to cause symptoms, but not interfere with consciousness. Affect brain positive enough to cause symptoms, but not enough to interfere with consciousness. All right. Now, symptoms will depend on area of brain, like occipital lobe will lead affection will lead to flashing lights. Motor cortex will lead to muscle jerking, that is known as Jacksonian seizures. It may proceed to focal seizures and may proceed to focal to generalized seizures also. All right. So this was about seizure auras. Now I'm gonna talk about the causes of the seizures. Now I'm gonna write for you seizures causes. Causes could be provoked and it could be epileptic. Epilepsy will cause recurrent unprovoked seizures. Alright. Now if I talk about the provoked ones, it could be fever, it could be lack of sleep, it could be drugs, it could be alcohol, it could be metabolic also, like hypoglycemia and hyponatremia. Alright. It could be head injury also. And whatever reasons are not provoked, it will include in epilepsy, like it will include recurrent unprovoked seizures. So basically, causes will include brain damage plus brain infections plus genetics plus use alcohol. So these are the 4 regions you can mention. All right. And these are the main regions for, not for mainly for seizures. They are for epilepsy. All right. See, in children, if I talk about according to the age groups, adults and elderly. In children, we have genetic regions, fever, trauma, congenital, metabolic. In adults, we have tumors, trauma, stroke, infection. And in elderly, we have stroke, tumor, trauma, metabolic, and infection. And see, I was talking about if I talk about in the metabolic ones, you can also include hypomagnesia and hypocalcemia also. Alright, if I talk about infection, infection may you can include meningoencephalitis. Okay. In congenital, you can include neurocongenital disorders, obviously. Okay. In the metabolic, we have done. In the genetic, you can include juvenile metabolic epilepsy. So these are the causes you can write about seizures. All right. You can see we have provoked ones, have epileptic, provoked में fever, lack of sleep, drugs, metabolic one. Epilepsy में we have brain damage, brain infection, genetics, alcohol. Children, adults, and elderly may we have differentiated tumor, fever, trauma, congenital, metabolic, tumor, trauma, stroke, infection, stroke, tumor, trauma, metabolic infection. All right. Congenital may you can have neurocongenital disorders, and genetic may we have metabolic juvenile metabolic epilepsy. In the metabolic, we have hypoglycemia, hyponatremia, hypomagnesia, and hypocalcemia. Okay. Now, if I talk about, see, I told you there is abnormal electrical disturbance, right? Wait for a sec. Okay. So, in the definition we have mentioned now, this abnormal electrical activity of the brain. Now on the EEG, see, Uh, in the EEG, that is electroencephalogram, it records obviously voltage changes in the brain. We have different leads, okay? We have frontal lead, we have temporal lead, we have parietal lead, and we have occipital lead, and there will be characteristic patterns. All right, and that is, I don't think it is important at our level to know the different patterns. After this, I want to come on the focal seizures. Focal seizures, they're actually partial seizures. Okay, in the partial seizure, we have discrete part of brain affected. Okay, most commonly is temporal lobe. All right, why? Because hippocampus is highly susceptible to seizures. Okay, now if I talk about focal aware term, focal aware term means there is no alteration of consciousness. All right, and if I talk about focal impaired awareness, so there will be altered consciousness. All right, and it may be preceded by aura. I told you in aura that it may lead to focal seizures, and it may lead to generalized seizures, right? And can spread to become tonic clonic seizures. Now, I told you that temporal lobe is the most affected one. So, can you tell me the problems the patient will have? Language, understanding language, organizing sequence, information retrieval, musical awareness, memory, hearing, learning, and feelings. Right? All right. Now, in the focal seizures, we are gonna talk about these two types in details. First, I'm going to talk about the focal seizures, focal aware seizures. So they are simple partial seizures. All right, there is no alteration in, I told you, there is no alteration of consciousness. There are going to be discrete neurologic features. Motor will be limb jerking. Okay, sensory symptoms, tingling, visual flashes, auditory hallucinations, and if I talk about autonomic ones, There will be nausea, sweating, and palpitations. And if I talk about psychic symptoms, they're gonna be deja vu, sudden fear, and distortion of what? Time. Okay? I'm gonna revise you this to you people, okay? Now I'm gonna talk about focal impaired awareness. Seizures. FIAS, focal impaired awareness seizures. Complex partial seizures, okay? There will be impaired awareness also. We know that as mentioned in the name. There will be, in the impaired awareness, what will it will include it like staring spells or behavioral arrest. There will be automatisms. Automatism terms is very very important. There will be repetitive purposeless behaviors. There will be lip smacking. There will be hand rubbing. There will be swallowing. And there will be post-ictal confusion afterward. Alright, so in the focal seizures, I told you that there are partial seizures. There is discrete part of brain affected. Mainly temporal lobe is affected. In the temporal lobe, there's mainly impairment in the understanding of language, organizing sequence, information retrieval, musical awareness, memory, hearing, learning, and feelings. Then there are two types: focal aware and focal impaired awareness. In the focal aware partial seizures, or there's no alteration of consciousness, but in the focal impaired awareness we have altered consciousness, and the focal seizures may be preceded by aura, and it can spread to become tonic cloning seizures that are type of generalized seizures. Okay, if it about the focal aware seizures, they are gonna be simple partial seizures, no alteration of consciousness, discrete neurological features, motor will be limb jerking, sensory symptoms will include tingling, visual flashes, and auditory hallucinations. Autonomic will include nausea, sweating, and palpitation. Psychic symptoms will include deja vu, sudden fear, and time distortion. In the focal impaired awareness seizures, we have complex partial seizures, and there's impaired um, awareness, obviously, and that is staring spells or behavioral arrest. Then we have then there are automatism, which includes repetitive purposeless behavioral lip smacking and hand rubbing and swallowing. All right, and there are post-ictal confusion afterwards. All right, in the focal seizures, I'm gonna tell you some two or more important points. After temporal lobe impairment, I told you most common site. Alright. There is mesial. This is related to temporal lobing also, and this there's mesial temporal sclerosis. This is very very important term. That is also known as hippocampal sclerosis. All right, that there is neuronal loss of hippocampus, and there is astrocyte proliferation. which is known as gliosis. Okay, and it is often bilateral, but one side is more common than the other. Often bilateral, but one side is more affected than the other, obviously. And diagnosis is by MRI. All right. Now, after the focal seizures, we are gonna talk about generalized seizures. Okay, in the generalized seizures, we have entire brain affected. Generalized seizures. Okay, we have entire brain affected, both lobes. Okay, and obviously there will be a sequence, maybe begin as aura, maybe aura leading to focal, leading to generalized. All right, and there are several subtypes, like absence, also known as petit mal. All right, there are tonic, clonic, grand mal. There are atonic, including drop seizure, and there are myoclonic. All right, absence, petit mal, tonic, clonic, atonic, and myoclonic. All right, absence, tonic, clonic, atonic, and myoclonic. If I talk about the absence one first, which are also known as petit mal, all right, they are sudden, brief spells, like 5 to 10 seconds, 5 to 15, sorry. All right, it will include staring, it will include eyelid fluttering. All right, there will be lip smacking, there will be no motor convulsions, there will be no postictal state, they are common in children. Okay, and classic EEG finding is 3 hertz spike and wave discharge. All right. Oh. 3 hertz means 3 cycles per second. Spike and wave is, it is shape of waveform. All right. Spike means sharp and high amplitude discharge, and wavy means, spike and wave, slower and broader waveform. All right. So when I was talking you about generalized seizures, I told you that they are going to affect entire brain. That means both brains. It may lead from focals, that can be caused by auras. Now, if I talk about the subtypes, in the subtypes we have absence, tonic, clonic, atonic, and myoclonic. If I talk about the absence one, we have sudden brief spells, staring, eyelid fluttering, lip smacking, no motor convulsions, no pre-ectal state, Common in children, classic EEG, we have 3 hertz spike and wave discharge. Spike and wave is shape of waveform. Spike is sharp and high wave amplitude change, and wave is slower, broader waveform. Okay. Now, if I talk about, just wait for a sec. Okay. So, if I talk about tonic-clonic seizures, okay. Oh, I don't do this much. Okay. Now I'm gonna talk about tonic-clonic. This time I'm gonna write beautifully. Tonic-clonic is sudden loss of consciousness. There is alternating stiffening then contraction. Alternating stiffening then contractions. There is tonic phase and there is clonic phase. Tonic is stiffening and clonic is muscle contraction. Okay, there is possibly urinary incontinence. There could be tongue biting. And it usually lasts for 1 to 2 minutes. Okay, and there is post-ictal confusion also. Alright, if I talk about atonic seizures, in the atonic seizures, that are also known as drop seizures, there is sudden loss of muscle tone. Okay, that causes falls, that is drop attacks, consciousness impaired or lost. Quickly resolve in seconds and may not have post-ictal phase. Classic cause of this atonic seizures are Lennox-Gastaut syndrome. Alright, it is actually childhood onset seizure syndrome that is associated with intellectual disability. I'm going to talk about this syndrome in detail further on after a few slides. Okay, we have myoclonic seizures. They are actually, sudden brief muscle jerks. Okay, usually bilaterally, obviously. Arms, shoulders, face. Okay, then we have classic causes of this is juvenile myoclonic epilepsy. I told you in of the genetic region. Often occur shortly after waking up. Okay, Now, if I talk about post-ictal state, the last topic for this video. All right. So, for the post-ictal phase, this transition between seizure to normal state. Okay, that is period of brain recovery. There could be confusion and lack of alertness. Okay, there could be focal neurological deficits may present. Okay, and it is variable. You know, it can lead to it can spread from minutes to hours. All right, there will be weak limbs, exhaustion, and sleepy. Okay, in the next one we will talk about some terms like juvenile myoclonic epilepsy, childhood absence epilepsy, Lennox-Gastaut syndrome, febrile seizures, eclampsia, status epilepticus. Okay, so these topics I will teach you, and also anticonvulsants I will try to start in the next video. Okay, so just I'm gonna revise the last things we have done from the tonic-clonic ones. In the tonic-clonic ones, we have sudden loss of consciousness. Okay, and alternating stiffening then contraction. Tonic means stiffening, tonic means muscle contractions. There could be possibly urinary incontinence, tongue biting, usually at 1 to 2 minutes. Post-ictal confusion also is also present. Atonic seizures, if I talk about, they are also known as drop seizures, sudden loss of muscle tone that can lead to causes falls. Consciousness impaired or lost, quickly resolved in second, and then the post-ictal phase may be there. The most common reason for this is Lennox-Gastaut syndrome, that is childhood onset seizure syndrome associated with the intellectual disability. And if I talk about myoclonic seizures, we have sudden brief muscle jerks, usually bilateral. Arms, shoulder, face are the included parts mainly, and the region are juvenile myoclonic epilepsy. All right, and post-ictal phase may, if I talk about seizures, the phase of seizures to normal state, that is period of brain recovery, and there's confusion, lack of alertness, focal neural deficits may present, and variable minutes to hours, and weak limbs and exhaustion and sleepy. All right, these are things you have to talk, you have to know about seizures. In short, this is the whole thing I will teach you. After this, we will talk about some syndromes and the anticonvulsants that are the drugs used for the seizures. Okay, thank you so much for the for watching my video, and I hope it is well enough to teach you people. Thank you so much. Bye bye.